Let's begin by discussing the reported numbers. First of all, not only are these very important because this is what is being shown to the masses daily, but they are also the leading factor for our government's decision-making regarding the lockdown, testing, vaccination procedures, etc. So, what do the numbers suggest? Well, currently in the UK there are just over 12,000 confirmed deaths. The way these deaths have been reported is that these people have died after being tested positive, not that they have specifically died directly from the virus. This is very subtle wordplay that have massive repercussions. They imply that these deaths are direct, however they are not. It has now been widely reported, though not through mainstream media, that a large portion of this devastating statistic has been overplayed and many other causes of deaths have been used to ramp up the numbers. You may ask, why would the doctors lie? Let's just be clear, the individual doctor and nurse is not lying and are doing a damn good job to try and save lives as they always have, however the parameters in which they have been told to work with is guided by a narrative that pushes this to happen. Many doctors have come forward, and more will, to say that they have been given a mandate which tells them to report any patient that tests positive for this virus, as the primary cause of death, and the actual disease, virus or symptoms they originally have or had is reported as the secondary and third, etc. This ensures that all patients that test positive, no matter what the initial ailment may have been, when they die, they are used as a statistic. Why would they do that, you ask? As I have stated, these statistics are the driving force behind our government's decisions, the lockdown, the social distancing, the economical nightmare. If the true death toll, the actual deaths purely caused by this virus, was shown, we would not have a lockdown, we would not need to distance ourselves and single out the already sick and vulnerable within our society. You see, they need these numbers to be scary, to continue to rise, to keep the narrative going. And it will continue, until they need the numbers to flatten off. This provides yet more trust from the people that when the government says jump, we say how high. However, the way they are obtaining these statistics clearly shows they have full control over the numbers and therefore full control over the actions and direction they wish to take us. Now again, let's be clear, good old Boris Johnson is not the one pushing this narrative, nor are the professionals stood beside him. They are all following guidelines that have come from a higher source. One source is the Imperial College. Here they ran a study and provided a report which scared the hell out of our government, showing that based on the initial numbers from China at the beginning, that there would be at least 500,000 deaths in the UK alone unless we follow the suggested guidelines. This report also included the same parameters for the US, which shown around 2.2 million people will die from this virus. This information was shared with the US. Imagine that report falling on your lap, from what you would have no reason, but to consider it is from a highly reputable source. What would you do? You would bloody well follow it, with the complete and honest intentions to save hundreds of thousands of lives. Well, that's what Boris and his administration have done, and done it well given the circumstances that have been forced upon them. The problem is this. The report uses computer programs that are given certain parameters to work with and the results thereof. The parameters used were initially from reported numbers from China and also early reports from Italy and other countries that first seen problems. These numbers again, have been obtained in the same manner as they are all over the world. If the parameters are false, then the results are false, and off track potentially by a very long way. A couple weeks after the report was published and the government began to implement its recommendations, Imperial College changed its initial outlook from potentially 500,000 deaths down to 20,000 deaths. That's a big bloody difference. Still awful, but a massive change nonetheless. With a potential 20,000 deaths, if we were to do nothing, our government would not have shut the country down. They may have stopped flights, etc., possibly isolated and safeguarded the most vulnerable, but most definitely would not have destroyed our economy and livelihoods. The health services most likely would only be a little more stretched than they usually are, but with some funding for more staff and equipment, they would manage just fine. As bad as 20,000 deaths is, in comparison to other causes of death in the UK so far this year, up to 3rd April there have been 30,760 deaths caused by influenza and a further 125,000 from all other deaths not including this virus. I am simply trying to show you that if were not for these false numbers and flawed reports being pushed, we would not be experiencing this so-called pandemic, no lockdowns, no panic and little fear. Going back to the control of the numbers, they can ensure that with the guidelines they have forced upon us shows to flatten the curve and lower the death rate. Or they can decide to keep it rising and tighten the restrictions on our lives and continue this circus act. Either way, it is full control, and so long as the media continue to spread fear, the people will on the whole willingly comply. Though, if they didn't comply, the government has already changed the law, allowing them to enforce very draconian laws against the will of the people. The bill was passed very rapidly at the beginning of all this, giving the government unprecedented powers against the people. They can by law enter any premises based on an assumption that you could be infected, remove you from that premises and take you to a facility and hold you, test you against or will and detain you further if you test positive. That brings us on to the testing. In short, the testing is also flawed. The test being used, which was created over 40 years ago, is a rather generic test that doesn't actually test for a specific virus cell. It can and has been weakened to widen the spectrum of positive results, which allows a very highly probable false positive outcome. It has been shown that because of this, many people who have other viruses within the system, and most of us do, this test picks up on that. It has also been suggested that it will most likely be showing a positive result on anyone that has ever been vaccinated in the past 5 to 10 years. An example would be false positive pregnancy tests due to proteins being present in your urine due to certain drugs and medicines being taken. The creator of the test being used all over the world, specifically stated way back when he created it, that it cannot and should not ever be used to test for a specific virus for these very same reasons. So, to recap, we have false death tolls and false positive cases being widely reported, collectively pushing our governments to take action under very false pretenses, spreading fear and depression across the population, causing nothing but misery, pain and suffering. It goes further. Most of you will have heard by now the mainstream media downplaying the so-called conspiracy about a possible connection between this virus and a new technology we will call 5th Gen. It does not take one very long to discover the overwhelming information available, providing all the evidence we need to prove what this tech is capable of. Literally thousands of doctors, scientists and people from the field itself from over 40 different countries have signed petitions to halt the rollout, simply to carry out further research on the safety before it is too late. Leaders from the industry itself have come forward and confirmed that not a single penny has been spent by them to research the safety parameters. The reason they can get away with this is because there is already in place a governing body that has signed off on much higher frequencies than are to be used, as safe. This allows the rollout to go forward with little to zero restraint. Now, there are many studies already showing how damaging this tech is. It shows that the 4th, 3rd, 2nd and even 1st gen tech has been highly damaging to plants, insects, birds and humans at a molecular level. After all, it is radiation we are talking about. The same that a microwave oven emits. The oven is simply protected by what is called a Faraday cage. However, these frequencies being pumped across our atmosphere, through our streets, homes and bodies at an exponential rate, are not shielded by anything. So much literature is available showing the physical harm these techs have caused, and this 5th gen is magnitudes stronger than what we have ever been subjected to. As an example, the current 4th gen and wireless tech runs from between 900 MHz and 3.2 GHz. 5th gen will initially run from 30 to 60 GHz, with the potential to reach 300 GHz and higher. The International Commission on Non-Ionizing Radiation Protection, or ICNIRP for short, is the only body that has set guidelines for these frequencies and themselves do not show the evidence as all other individual studies show. ICNIRP has shown references to cancers, mood changes etc., especially in children, but the study highly downplays and in part ignores the clear factors that certain frequencies may cause severe damage to cells and reduce oxygen levels in the blood. ICNIRP specifically focused on the possibility of the body temperature raising by less than 1 degree Celsius, but only when emitted with a long exposure at high frequency. Going back to the Imperial College report, you have to ask who funded these studies, and therein lies the rub. Now, speculative thinking can easily concoct a number of theories, but critical thinking can connect the dots to form a very clear picture. Studies and literature suggesting each spike in tech from 1st gen to 4th gen, i.e. telegraph poles on the late 1900s to mobile and wireless today, has walked hand in hand with worldwide effects in all walks of life, in particular, human epidemics. With the sudden rollout of 5th gen and the current issue we are facing worldwide, it is not hard to see what may very well be going on. Do the powers that be really know all this information? And I don't mean our puppet politicians, I mean the real key holders. Of course they do. To what means is all this for? More profit, more power. Most likely. But does this go even deeper? Is there a long game agenda in play here? Some say yes. Do your research and you decide.